Hello, and welcome to the Systems Medicine channel. My name is Adigo. I am a systems medicine doctor. In 2013, while visiting Chicago, overnight I developed a frozen shoulder, also known as adhesive capsulitis. The pain was excruciating, and because the shoulder joint is so mobile, I just could not get comfortable for the few days that the pain lasted. It was a miserable time. Over the next few years, I had repeated bouts, each one as painful as the last. It simply didn't make sense to me that I had developed what we are taught is a degenerative shoulder disease in my late 30s without a prior injury. So I put my investigator hat on and drew on my training in systems medicine, asking what else might be going on here. Here is just one hypothesis that might surprise you. This is a spirochete. It's a type of bacteria shaped like a corkscrew. You probably know one or two diseases that spirochetes cause. I'm sure you've heard of syphilis and Lyme disease, and maybe you've also heard of yours. And there are more. Let's take a closer look at Lyme disease. Lyme disease is caused by a spirochete called Borrelia burgdorferi, and it's transmitted by an insect bite. When you are bitten by a tick, it injects the bacteria under the skin. Although your body detects the newcomer and tries to clear it, the spirochete has many tricks it uses to try to survive. Borrelia dissolves fibrin, a structural component of tissues. It breaks down the junction between cells and enters different body compartments. It can also live inside a cell. Borrelia lowers immune function, and it sticks to itself and other bacteria, exuding a layer of slime to form a protective biofilm. In this way, Borrelia can escape detection, set up home, and cause disease. In this study, out of 200 patients treated for a tick bite, 92.5% of them had muscle pain, joint pain, nerve pain, and headache well after treatment. In another study, when 73 patients with chronic Lyme disease were reviewed, 53 of them had symptoms affecting their muscles and joints. So, could Lyme disease be a cause of shoulder pain? The answer is a resounding, drum roll, maybe. It may not be a first-line cause, but it's certainly a possibility. And if you're not looking for it, you might miss it, especially when no other cause has been found. With studied care, I'm glad to say that my shoulder is now better. It is more than I have time for to go into what I did to make it so. Regardless, systems medicine is about managing the whole. There is no one size fits all. What worked for me might not work for you. If you are suffering from a painful shoulder or any other condition, I encourage you to ask questions. Try to understand for yourself what is going on. Don't take anyone's word for it. You might say, I don't have a medical degree. How can I possibly understand? Or there are mixed messages. My doctor says this, another doctor says that. Each one presents scientific evidence. Who do I believe? Often, I find that an individual wants someone else to tell them what to do, to decide the matter for them. Indeed, we are conditioned to defer to authority. It seems easier than trying to figure it out ourselves. But this is giving up your responsibility. If you want to take back control of your health, there is no way around learning for yourself and weighing up the arguments to reach a decision. That's where I come in. With this channel, I want to support you in your learning. I want to help you join the dots from A to B. I want to walk alongside you, not speak from a place of authority. I want to help build your understanding, to help you make the right decisions for you. Although I have my own sense of what works and what doesn't, I'm not advocating a particular path. Let us move away from dogma, away from being in one camp or the other. Instead, let us talk mechanisms and pathways as the basis for understanding how the body works. My guiding principle is to stay close to nature. Nature doesn't take sides, and she houses many different expressions of life. So, walk with me as I break down the complexity of the human body to help build understanding towards better health for all.